Ways to motivate a person to quit drinking. A person needs motivation to be able to quit drinking. Without it, there is no point in starting therapy, treatment out of fear, under compulsion, without the patient's personal interest will at best give a temporary effect. Finding, forming and strengthening the motivation to give up alcohol is one of the most difficult tasks of psychotherapy. Every patient has his own reasons for alcohol addiction and his own motivation for overcoming it. The psychotherapists at Narcodoc will help you to find and strengthen them. Reasons for quitting alcohol. To identify such motives, you need to understand why the person began to drink. With the help of alcohol, patients try to solve problems or hide from them. By identifying these problems, it is possible to find a motive for giving up alcohol, to change the person's life so that he was happy and without alcohol. Family. Traumatic events in childhood, a negative example while growing up, unhealthy relationships in the family become the cause of alcohol dependence. A person grows up, acquires his own family, and continues to act according to the model he is already familiar with. Relationships with loved ones deteriorate, but the patient does nothing to fix them. He or she either considers that he or she is not understood, or is simply satisfied with the existing conflict environment. Often the motive for giving up alcohol is the children. If the patient does not want to pass on his model to them, it is possible to work with this, to teach the person to enjoy communication with the child, to value this communication, to strengthen the emotional connection. Other options for family therapy are also possible with the participation of spouses or close relatives. Realizing that in the circle of the family it is possible to receive support, the patient gets an incentive to give up alcohol. Career. There are two main options. Work can become the reason of alcoholism because of the high level of stress, constant tension, or established tradition in a collective to drink alcohol after the end of the working day. Here an objective analysis will help. A person needs to understand that alcohol prevents him from being productive, does not reduce, but increases the level of stress, reduces his success, and harms his reputation. Another option is when a career doesn't pan out because of alcohol. To the employee addicted to alcohol, the management will not entrust the responsible position, will not increase the salary, will not go to meet. You can survive for years on small earnings, and the situation will worsen as the alcohol addiction worsens. The patient must understand that this is a dead-end road. Giving up alcohol will give him the opportunity to find a good job, to take an attractive position. Environment. If a person drinks for the company, the example of comrades can motivate him to treatment. In such companies there is always someone who is already drunk, who has no control over his behavior, who has serious health problems. Such an example is a good motivation. Without treatment, a person will quickly find himself in the same position. Health. With alcoholism, health deteriorates gradually, and the person does not notice these changes. The motivation for treatment appears if there are already severe illnesses, severe pain, if life-threatening situations occur. It is important for a person to understand that he can restore his health, feel well, and without alcohol. Appearance. This is an important incentive for women. Alcohol use ages and disfigures. The longer the addiction lasts, the more negative changes appear. It will be possible to return attractiveness only by completely giving up alcohol, and it is better to do it as early as possible. After a certain stage of dependence, the traces of alcoholism remain on the face and figure forever. Psychological condition. Alcohol relaxes, gives a sense of euphoria, and causes pleasant emotions, but this effect quickly passes. When addiction is formed, the effect becomes opposite. Because of alcohol, the psyche becomes unstable. There are sleep disorders, anxiety and suspiciousness, rapid fatigability, problems with solving even simple mental tasks. Immediately after giving up alcohol, these signs will worsen, but then the normal psychological state will be restored. This can be a good motivation in the early stages of addiction, when the person is still able to monitor and analyze changes in their behavior. Psychotherapeutic treatment. How do you develop motivation to quit drinking? Simply laying out to a person the reasons why he should quit drinking is not enough. He already knows about them, but he continues to drink alcohol. In order for these reasons to become valid, it is necessary to work with a psychotherapist. It is carried out in several stages. Informing. At the first meetings, the psychotherapist gives the patient information about alcohol addiction, its influence on health, emotional state, relations with relatives, and other spheres. The information is presented so that the patient sees this influence in his life and is able to estimate its scale and consequences. The patient needs to understand the mechanism of addiction, learn to monitor its manifestations, correctly assess the impact of alcohol on all areas of life. The psychotherapist gives the information gradually. It is important that the person assimilates it, fully accepts it, and becomes aware of it. At the information stage, the patient admits that he or she has a problem with alcohol and understands the extent of the problem. Finding motivation starts with identifying the causes that triggered the development of alcohol dependence. If these are emotional traumas, the therapist helps to deal with them. If alcoholism appeared because of personality peculiarities, the doctor will teach how to control them. To form motivation to overcome addiction, it is necessary to show the patient that he can cope with their problems and without alcohol. This is done by determining the range of these problems and figuring out how the person's life will change if he stops solving them with alcohol. Persuasion. At this stage, it is necessary to make the reasons for giving up alcohol important and meaningful to the patient. They have to outweigh the desire to drink. Effective persuasion is built without pressure or intimidation. Motivational work is constructed so that the person himself comes to the correct conclusions, accepts and understands them. He has to have a desire to overcome alcohol addiction, reinforcement and support. The final stage of psychotherapy, the doctor supports the formed motivation, keeps it highly significant for the patient, draws his attention to the positive changes which are already taking place in his life.